When the patient or any procedure that you are doing for the maxilla, if you want to make easy ergonomics, maxilla should be perpendicular to the floor, open wide. So again, if you look at the maxillary arch, it's more or less perpendicular to the floor. Can I lean down slightly more? Yes, I can. This automatically allows the neck of the patient to be a lot more relaxed because you're leaning back. It's going to allow them to open up the mandible. So when you're working on the maxilla, this is a much better position for me to scan versus me going like this. Second thing, let's talk about how high the patient needs to be. We talked about shoulder to elbow level. When I am working on the maxilla, I am usually going to keep my patient somewhere about the maxilla, same level as the elbow. There are times when I go as high as bringing the chair up to all the way to my shoulder level. I don't usually need to do that. That used to be an old denture concept. But the idea again is that I keep everything at my elbow level. Now again, how do we really start a maxillary scan? We all know in dentistry we use clock positions. So I always stand somewhere around 7, 8 position so that I'm about 45 degrees this way. If you're left-handed, you're going to stand same around that position, what we call 4 or 5 o'clock position. This is 7, 8 o'clock position. Have the patient turn towards me. Turn a little bit towards me, please. So, simple thing. Let's look at it this way. I told the patient, turn towards me. They will immediately look down. So, they are turning but looking down. Don't overlook these little things. They play a role. So, turn towards me and now chin up to the sky. See how the maxilla automatically became perpendicular to the floor. When the patient is looking down like this, all the hard work that you did, you lost the ergonomic position. Little things matter. Lift your chin up, open wide. Again, one of my finger is retracting. When the patient opens wide, now for video purposes, I want you to turn to the left a little bit, open wide, holding this. Do you feel that my finger is colliding against this molar? Meaning that the ramus of the mandible is going to get, and the condyle, when the patient opens, think about the anatomy, when the patient opens, the condyle and the ramus get close to the second molar and the first molar, so you do not have enough space for the scanner to swivel around. So the way you want to do this, open wide, I'm going to put one finger here so you can feel the mandible. That's where what I call tactile sensation, feeling matters. So feel it, feel how the bone is. Don't have long nails so that you're poking the patient there. Be gentle, be very easygoing with the patient, but you need to be able to feel. Now open wide, I have no space, so I tell the patient, relax your jaw. While the patient relax, I'm feeling. Now I can see the mandible going back into the rest position, and you can automatically feel my finger going in.